Let's talk about the clinical manifestations or the clinical features of the COVID-19 disease in greater detail. So, after having basically increasing understanding of the disease, with the disease being spread to the almost all parts of the world, it has been found that initially, majorly, three major cardinal symptoms that the patients develop are the fever, dyspnea, or cough, and certain types of myalgias. Out of them, almost all the patients with the symptomatic coronavirus disease presented with fevers. As much as 99% of the patients, they had a fever on initial presentation. After fever, the most common symptom which was present in about 70% of the patients was fatigue or myalgia. The patient complained that they were feeling like someone has beaten them. This was a classical presentation of certain types of patients, that they are feeling fatigued, or they have feeling body aches like they have been beaten. So fatigue is present in about 70% of the presenting complaint, and fever is almost present in every patient presenting with the coronavirus disease. Along with that, a classical type of cough, which is a classical dry cough, and it is a continuous cough. It is present in about 59% of the patients in initial presentation. So these three major symptoms, if someone is having fever, fatigue, or dry cough, and it has been recurrent and going on for about 4 to 5 days continuously, then especially if they belong to an area or have recently traveled to an area who has a large number of coronavirus disease, so they should have a higher degree of suspicion for the COVID-19 infection, and it is very important for them to either get tested or either quarantine themselves to wait that the symptoms start improving and they don't go into the fiat complications of the disease. Apart from them, there are certain other types of symptomatic presentation, like patients might have anorexia. Certain patients develop myalgias, about 30 to 35% of the population. If someone is having a severe type of coronavirus infection, they will present with dyspnea or difficulty in breathing. This is relatively less common. About 30 to 35% of the patients present initially with dyspnea. Or the initial presentation can be cough with very scant sputum. Sputum production is very scant. It is generally found out in about 25 to 30% of the patients. Generally, the classic symptoms of the disease is a dry cough, and it is a recurrent cough. It keeps on getting worse, and it also can get to a point that the patient cannot talk in one proper sentence without coughing. And if that is basically recurrent and developing in someone, that they should have a higher degree of suspicion of having a coronavirus disease. What are certain rare symptoms or the less common symptoms? Rarely the patients can present with headache, or the patients might have certain upper respiratory tract disease symptoms like the rhinorrhea, or sneezing, or certain types of sore throat, and certain types of nausea. So as you can see, that these symptoms are very common in all types of flu infections. These are classical symptoms of influenza infection. And that's why it has become very difficult to clinically diagnose someone, differentiate someone having certain influenza or a viral flu from someone having a severe coronavirus disease. That's why if you have someone who has a persistent upper respiratory tract infection symptoms like rhinorrhea or sneezing or headache, and they are not getting better with time, and so specifically if they have also developed low-grade fever starting with 99 degrees Fahrenheit and then progressing to 100 or 101, then they should have a higher degree of suspicion, especially in the current scenario, to be considered a coronavirus patient, and should be screened for it either, or should be quarantined until the patient gets better, or either you have a test result of that patient. In certain rare population, we have also seen that the patients presented with diarrhea or the GI complications like nausea or vomiting, but they are very rare and they have not been considered to be the classical symptoms of the disease. And they are all of these are very non-specific symptoms. You can almost see these symptoms in a majority of the diseases. So that's why it makes it clinically difficult to diagnose someone with a coronavirus disease, and we have to rely on the basically the current scenario of the disease severity in that part of the world, and also the patient's immune system and a lot of other things.